got a great one today, finally. My two first-time guests are Tom Frieden, former director of the Center for Disease Control and Prevention, and Brandy Zadrozny, investigative journalist and reporter with NBC News, and MSNBC, who's been reporting on the CDC and RFK Jr.'s leadership of Health and Human Services. It may not come as a surprise to you, but Kennedy is leading the charge against vaccinations and their alleged link to autism, something that science doesn't agree with. But a large part of the MAGA base does, and Trump believes that Kennedy helped him win the election. That's why Trump took a leadership role last week, exhorting pregnant women not to take Tylenol. As Dr. Frieden says, that is totally against the science and potentially dangerous to the baby. Why Trump feels the need to inject himself into these things, I don't know. Remember when he urged Americans to inject bleach to kill COVID inside their bodies? Biden brought that up during the 2020 debates.
And by the way, maybe you could inject some bleach in your arm, and that would take care of it. This is the same man.
That was said sarcastically, that was that was said sarcastically.
And so here's the deal.
So that was that was him in the debate, and this is him when he supposedly was being sarcastic.
Right, and then I see the disinfectant where it knocks it out in 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting to me.
That didn't sound so sarcastic to me. Well, right now, Trump is all aboard the RFK Jr. train, and it's a dangerous train, indeed, for Americans who will not be getting their shots. So take a listen to my conversation with Tom Frieden and Brandy Zadrozny. It's a great one, for a change. We're going to talk a lot about Bobby Kennedy Jr., but let's go to Trump first, injecting himself into this stuff. He contradicted mainstream medical consensus and announced that Tylenol is tied to autism. Brandy, you covered this story. He said a pregnant woman taking Tylenol can be associated with increased risk of autism. But that's not true, right?
Well, I think we should let Dr. Frieden handle some of that. I will say it's really hard to prove a negative. Like, this is why, these folks, Kennedy especially, kind of lives in this area where, science is science, and science rarely says, there's absolutely no way that this has no cause, right? That doesn't cause whatever. And so he lives in that area and he's like, well, then prove that it doesn't. It's like, well, that's not how it works. So I think the overwhelming sort of the science that we do have seems to suggest that no, if you take a Tylenol while you're pregnant, your child will not have autism.
I would make that a little more nuanced.
Okay.
I would say, first off, that we know that fever and pain lead to worse birth outcomes. Therefore, the advice to women to tough it out is really bad advice. And the big advice I would give is don't get your medical advice from politicians or lawyers, get it from doctors. And what a doctor, an obstetrician will tell a pregnant woman is, if you have a fever, it's important to bring it down. And guess which medicine is safest? Tylenol, acetaminophen. To do that, safer than aspirin, safer than ibuprofen or Motrin.
Now, JAMA did a study of 2.5 million Swedish women. Is that it?
Yep, that's the study. That's the one. So it's a really interesting study. And it comes to what I call technical rigor. And I'm going to admit this right up front. I've got a book coming out in The Formula for Better Health. And this is one of the key themes. If you have bad science and bad studies, you can apparently show a relationship that's not really there. And there are studies that suggest a slight increase in risk of autism among women who had Tylenol in the cord blood at birth or who had exposures to Tylenol. And some studies do show that association. But when you're talking about real science, you have to look rigorously at the best science. And that Swedish study is amazing. It's amazing. They studied 2.5 million kids for 20 years. And they studied them what's called prospectively, which means they collected information by midwives, structured interview in the first trimester of pregnancy. And then they followed the kids. And because it's Sweden, they basically followed virtually everyone. And they didn't just find that there's no real association between Tylenol and autism. They found that if you don't correct for what's called a sibling effect, it looks like there's a relationship. So not only did they show that based on the best available evidence today, there is no association between Tylenol and autism, but they showed that the studies that have found that are almost certainly wrong.
I guess I should have gone to you first.
See, better.
I mean, something causes autism. What does cause autism?
We really don't know. It is complicated. First off, how much is autism increasing? A lot of the increase is because we're diagnosing it better. We're defining it differently. So a lot of the increase isn't a real increase in the condition. It's an increase in recognition and diagnosis. But CDC, the agency that gets maligned by the current health secretary, CDC has for decades done rigorous studies. So we actually know that it is true that autism is actually increasing. And we don't know why. We do know that there are many different genetic contributors to autism. And we do know that there are a couple of things that do increase the risk. One is folate deficiency. The second is increasing parental age, which is just a trend currently. There's another theory, which is what's called assortative mating, which is that like people are increasingly having children together. And that's another theory.
Okay. Now, we started talking about Secretary Kennedy and his views on his CDC. He fired his CDC, Susan Menares. Is that how you pronounce her name?
Yep.
What was it? Short of a month, right?
Yes.
29 days, I think.
There was a hearing in which Kennedy said why he fired her. Do you know what I'm talking about?
Craziest moment. I mean, it's so hard to qualify. There's so many superlatives each time.
Can we play the third Warren audio?
You tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign?
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no.
Sounds believable. But it sounds like a conversation that totally happened.
Yeah, I mean,
I can still see Bernie's face actually because he was sitting next to Warren when he said this, and it was just like, what? There's no way that conversation happened in the way that you're describing it.
Okay, I'm assuming that Susan Menares didn't say that she was untrustworthy. What was her side of the story?
According to her testimony at a later hearing, he brought her in and basically said two things. One, he said, I want you to rubber stamp, approve everything that's going to come out of this next ACIP panel, this vaccine recommendation federal committee hearing. And she said, well, let me see what they're going to say. Like, let me see the data that's going to support what you think they're going to say or what they're going to recommend. And he said, no, I'm not going to show you that. There's apparently nothing to show. And she said, well, I can't do that until I see the data. And he said, oh, yes. And by the way, the senior CDC officials that are basically right under you that run CDC, I want you to fire all of them for no cause.
Or these the people who pick the vaccines?
The panel is the federal panel that recommends to the CDC, and that those recommendations are usually adopted, and they become really important because those recommendations are important for what insurance covers, what the Vaccines for Children's program covers. It's sort of like it's just a very, very important piece of the vaccine infrastructure in this country.
What is the group that designates which vaccines are used? The AC.
ACIP.
Yeah.
Yeah, that's the ACIP. And the people she wanted to fire are the people, Dr. Dimitri, Daskalakis, thank you. And two other officials that were basically like running CDC. They were the heads, very respected within CDC. That was a really shocking moment that I think you probably remember, like when they left CDC, everybody did the walkout for them and came and clapped. That was just like an earth-shattering moment. He wanted all those people fired. She said no, so they resigned in protest.
I'm actually not sure who he wanted fired, but those three resigned in protest, whether it was only those, whether it was more, but what we're seeing really is a wholesale destruction of our health protections. 2,000 staff at CDC let go. Half of CDC's centers.
2,000 staff let go?
Yeah. Yes.
Out of how many?
Well, depends on how you count it. A little more than 10,000, so almost 20%.
And it's important to know the ones that have left are often the ones that took an early buyout are people that were there for, sometimes decades, who were really like, and just said, I can't take this anymore. I'm too old for this, or I did not sign up for this, or I know I can't do good work, or it's close to my retirement. Like all of these things played in, but they're losing, and I'll let Dr. Frieden say if I'm wrong here, but it seems to me they're losing some of the brightest minds and strongest leaders that really made the CDC what it was.
I will say one slight positive note. I went through the ACIP meeting and the CDC presentations there were still fantastic. And I know some of the people giving them, they're really dedicated scientists. They're at the top of their game and they gave great presentations. And then you heard crazy questions and questioning.
Well, who are the people who he chose to be on the ACIP? Who chose them?
These are folks who either have long-standing anti-vaccine views, have been some of the main purveyors of misinformation, not all of them, but some of them, and have stated things like that they're certain that vaccines cause autism, which has been repeatedly studied in millions of children, and there's no evidence for that. So it's really a striking thing. And I guess, one of the things I think we have to think about is what are some of the underlying motivations? Because if RFK Jr., trial lawyer who sues companies and makes money from it, has a credible argument that vaccines cause autism, there's a lot of kids with autism in the U.S. and the vaccine makers have deep pockets. That's a lot of money in them there lawsuits.
Did he ever bring suit against a vaccine?
Yes. He consulted for companies that did. And he has refused to not take the money. He says, "Oh, I won't take the money. I'll give it to my son if we make money from that."
Oh,
because that's not a conflict of interest, right?
Well, could he give it to my son? That would be less of a conflict of interest for him, I would think. Okay, so he has made money doing this practice, basically.
Yes.
Okay. Were you at the ACIP meeting, Brandy? No.
I was not in Atlanta. I watched it on YouTube.
You watched it on YouTube?
I did, yeah.
How contentious was it?
It's hard to say contentious CDC staff are so professional in the midst of all of this insanity. I'm really I've been trying to channel them just in my day-to-day life. Just very professional, always about the facts. They don't seem to get their feathers ruffled, but the hearing overall was very contentious because you did have on the line and you had the medical associations. Now you had these medical associations and they were saying I am only here for our patients and I am only here for the facts. Right out of the gate, they made that very clear. And so as the hearing progressed, like Dr. Frieden said, you had questions that were asked that were seemingly not scientific, not something you'd usually hear at an ACIP meeting, sort of wild, sort of conspiracy theory laden questions about vaccines causing harm. And at one point, there's this one panel member who is a professor, I think, of mathematics and of organization, not in any medical field or not a doctor, not a scientist like that. But he became sort of a COVID truther. He has this tweet up or this X post up where he says that vaccines are deadly and they're killing young people and we have to take them off the market. Well, now he's on the ACIP panel. And so at one point he said something like, well, we have to be very scientific and science is the most important thing. Very, very Robert F. Kennedy of him, saying the gold standard science, words that mean nothing to them. And I guess somebody was unmuted and they just said, idiot. Like that, it was this moment that sort of voiced what everybody was probably thinking in that meeting, but that's kind of characteristic for how people were feeling. And I will say, the AAP didn't even come. So they've said that the proceedings there are illegitimate. So which sort of gives you an idea, and they're making their own vaccine recommendations.
Who didn't come?
For years.
American Association of Pediatrics.
The AAP didn't come at all, and they were sort of it's a really interesting train of thought here, and that I think is important. And I don't know the answer to it, but there are some groups like the American Academy of Pediatrics that is no longer entertaining ACIP or CDC as a credible body.
But they are they are the body who makes the determination.
I think you've made a real important point, which is look at what they do, not what they say. They say they want to restore trust, and yet RFK Jr. and some of the people who are now on this committee are the main purveyors of disinformation and distrust with a bunch of debunked, dangerous, frankly, deadly theories. And it's really unprecedented. You have the Doctors Association saying, we're not going to follow what ACIP says anymore. And you have the insurers saying, something, we don't want our insured people getting sick because that's really expensive. So we're not going to follow what the new ACIP says. This has never happened before.
Can I ask you that question though, Dr. Frieden? And I'm curious, is it better to abstain and delegitimize something that's not legitimate, or is it better to go and have your voice heard and fight back within the institution?
I think it's always better to speak up, respectfully. One of the things we've found is that it is really important to listen, because the folks who are preying on people's concerns are not making those concerns up. Those concerns are real. Parents are concerned. They can't get good access to healthcare. 100 million Americans don't have access to primary care. It's absurd. We spend $4 trillion on healthcare and we can't get the basic thing. Our healthcare system is so messed up and driven by profit instead of health.
Okay, we're going to take a quick break. We'll be right back with Tom Frieden and Brandy Zadrozny. You know what doesn't belong in your summer plans? Getting burned by your wireless bill. While you're planning beach trips, barbecues, and 3-day weekends, your wireless bill should be the last thing holding you back. With Mint Mobile, you can get the coverage and speed you're used to, but for way less. And for a limited time, Mint Mobile is offering 3 months of unlimited premium wireless service for $15 a month. So while your friends are sweating over data overages and surprise charges, you'll be chilling literally and financially. Well, maybe not literally, but financially. Say bye-bye to your overpriced wireless plan's jaw-dropping monthly bills and unexpected overages. Mint Mobile is here to rescue you. All plans come with high-speed data and unlimited talk and text delivered on the nation's largest 5G network. Use your own phone with any Mint Mobile plan and bring your phone number along with all your existing contacts. Ditch overpriced wireless and get 3 months of unlimited service with Mint Mobile for $15 a month. You've got a lot of options, and Mint Mobile is an affordable choice. Compare Mint Mobile's wireless service with your current provider and see how much you could be saving with Mint Mobile. This year, skip breaking a sweat and breaking the bank. Get this new customer offer and your 3-month unlimited wireless plan for just $15 a month at mintmobile.com/Franken. That's mintmobile.com/Franken. Upfront payment of $45 required, equivalent of $14 a month. Limited time new customer offer for first 3 months only. Speeds may slow above 35 gigabytes on unlimited plan. Taxes and fees extra. See Mint Mobile for details. And we are back with Tom Frieden and Brandy Zadrozny. What's going to happen in terms of availability of vaccinations? I mean, that's kind of the next question here, because it was, before you'd go to the pharmacy and get a free shot. Is that going to be happening or not?
So far, it's with a minor exception that's a minor exception and a moderate exception that's kind of preserved. The moderate exception is still very confusing and up for grabs today, which is COVID vaccination for healthy young adults. Now, I mean, we can go as deep as you want on this, but
that's if you're under 64 or something, or under 65.
Yeah, and you don't have any underlying conditions. The FDA didn't authorize it, but then the CDC recommended under what's called shared clinical decision-making. In other words, talk with a health professional. In some states of the U.S., that may mean you can't get it at the pharmacy, but most states are doing the same thing that pediatricians and the obstetricians did, which is we're ignoring this because it doesn't make sense. And so you can still get vaccinations in most places, but there may be barriers, and we may see more of those coming up. So this is kind of just the start of disrupting, not bad things, but disrupting our safety net that protects us.
There were controversies about specific vaccines and when to take them, like Hep B.
Oh my goodness. This is a fire hose of falsehoods. We're seeing just every sentence, it seems, there's another piece of nonsense spread. The latest being, kids shouldn't get the Hep B vaccine because hepatitis B is a sexually transmitted disease, and therefore it doesn't make any sense to give it to newborns. Wait till they're 12 or wait till they're 4 or 5. It's totally wrong.
And a mother can have a sexually transmitted disease, right?
Well, the mother.
I'm not a doctor, so
right. The mother passes it to the infant. It's called perinatal transmission. It's quite common. So if you don't vaccinate the infant, before the U.S. did that, between 10 and 20,000 kids in this country got this viral infection every year, and about a quarter of them will die from it. So you're talking about thousands of American kids dying if they change this recommendation and the groups follow their change, or they disallow it for certain groups. And this is based on really theories that have absolutely no evidence.
So what we're talking about is whether to give a newborn a Hep B shot, right?
Absolutely.
Okay. So, and that's the controversy here. And I know that Senator Cassidy of Louisiana is a liver doctor, right?
He is. He feels very passionately about this.
And I think he's the one who cast the vote that made Kennedy gave him the job.
Yeah, his vote brought it out of the Help Committee and allowed it to be voted on the Senate floor. And that's how he got in.
Jesus.
I know. It's so disappointing.
And so are they going to give newborns the Hep B shot?
What they didn't, it was on the agenda, and then it was postponed indefinitely. And the first rumor was that it was postponed because maybe some people within the administration thought it's not a good idea to pass policies that are going to result in the deaths of thousands of American children. And it kind of provably will result in that if followed. And then yesterday it came out, no, it was postponed because one of the members of the committee wanted to delay the birth dose till 12, not till age 4, which would be even more dangerous. So you're seeing basically the hijacking of CDC, the hijacking of this very important group that has been setting vaccine policy that has prevented billions of dollars of healthcare costs, prevented disability and deaths for the last 35 years, 40 years, 60 years for the committee, 40 years for the Vaccines for Children program.
So this is a nightmare. And Trump also weighed in on the schedule of vaccines, didn't he?
Yes, and on Tylenol and on other issues as well. I would just go back to the basic point. Let's get our medical advice from doctors and nurses, not from politicians and trial lawyers, and certainly not from people who have an interest in suing vaccine manufacturers. Not that I think vaccine manufacturers are blameless. I think they charge way too much for their vaccines. But the fact is that if you allow lawsuits based on no actual data of harm, you really mess up the ability of companies to behave responsibly and function effectively in this country.
Trump's comments were super unhinged, but also really interesting because it showed, I think, for the first time, there was some questions about like what Trump really believed. And, you know, he brought in Kennedy early on before his first term or during his first term because he was going to make him remember the vaccine committee chair for safe vaccines or something or other. And
Jeez.
he brought Kennedy in and he had a meeting with the transition team. And they came out of that meeting saying, this guy is nuts. He cannot be anywhere near this administration. They were trying to like be, you know, buttoned up. They were trying to be real. No one thought they would win and they did. And they're like, we can't have this guy. And so they booted him out. And now not only, we always knew that Trump thought, because he had tweets about like autism and vaccines, we knew that he sort of thought that, but we really didn't understand like the length to which he believed in this stuff. And now that press conference just showed two things. One, he seems to really believe this stuff, like believe it wholeheartedly. And two is that he is embracing what Kennedy has spent the last 10 years building, which is turning the anti-vaccine movement really into a political movement, like building MAHA. And he wants MAHA desperately. And so Trump was even saying, he sort of took the mantle from RFK at that press conference. You saw Kennedy was standing behind him, almost dejected, it looked like. He just looked so sad. And Trump said, I'm sorry, I know that Kennedy wants to go slower, but I'm forging ahead. And then all of the sort of MAHA minions are now like, yay, you know, Trump's really behind MAHA. He's really leading MAHA. He's going even further than Kennedy. So it's just this really interesting time that like Trump has sort of stolen MAHA from Kennedy now with his like insane comments.
How much of MAHA is the vaccine stuff and how much is other stuff?
You know, it's a very broad group. So you have a lot of people who are legitimately concerned. Again, look what they do, not what they say. So he says he's interested or concerned about environmental contamination, but what has this administration done? They've rolled back the reduction of forever chemicals like PFAS in our water. So that was going to be phased out sooner. They're pushing it way back to be phased out later. They've rolled back protections against mercury and arsenic that have gone in. One of the things that kills a lot of people in this country is soot, what's called PM 2.5. They've rolled back regulation of that. So, and they've ended the CDC program for tobacco control and rolled back the FDA efforts to reduce tobacco harms. So they say they want to stop chronic disease, but they eliminate the programs that are intended to address chronic disease. They say they want to reduce environmental contamination, but they're allowing more environmental contamination.
And of course, at the UN, Trump said that climate change is the biggest hoax ever. And that means we're going away from renewables on our energy, and we're going to be using more oil and gas and fossil fuel, which kills people, right?
Well, it causes PM 2.5 pollution and other pollution. And yes, that results in, the estimate is for the U.S., about 100,000 deaths a year currently.
Okay. So make America healthy again.
The things in terms of like what Kennedy cares about, we can see through, you know, his policies, what he's doing right now, and then just his activities. And it's he cares about the Indian Health Service. He has long envisioned himself as a friend to Native American groups. And so for whatever reason, that is something that's really important to him. He has gone to Alaska. He's done a lot with it. That's like the Indian Health Services was the one thing he didn't cut immediately when he came on. And not only that, the people that he didn't like, the CDC officials that he didn't like, he actually sent them to the Indian Health Service. He's like, you are all going to go to these specific outposts. That was kind of like their punishment. The other thing that he cares about are vaccines. He has fired everyone or just refused to listen to anyone who counters him on vaccines. And what he has done is, it's really remarkable. He has installed pretty quietly the original architects of the anti-vaccine movement within HHS and CDC. So you have Geyer, the researcher who brought us the terrible science about vaccines, who literally got in trouble with a state health board for acting as a doctor because he and his father were running experiments on autistic children, giving them puberty blockers, which apparently the GOP is supposed to hate this now, but ran experiments giving autistic children puberty blockers. He's now in CDC torturing data to try to uncover some autism vaccine risk. Lynn Redwood, the autism mother who started Safe Minds, an anti-vaccine advocacy group. Stephanie Spear, who long worked for Children's Health Defense, is his #1 deputy. Like, he has surrounded himself with these anti-vaccine people, and it's the only people that he's speaking to. He said it in Congress. They said, who are you talking to if not the CDC officials? And he said, Bill Thompson. Bill Thompson is a longtime CDC guy. He's worked with data. He is a scientist, but he's the so-called whistleblower in one of the longest running anti-vaccine conspiracy theories. He's still in CDC, and this is his advisor. So it's just, he's running the anti-vaccine movement from within the CDC. That is what he cares about.
I think one of the things that surprised me most is that Deb Howry, who was running the CDC for a while, she was one of the three who resigned. Yeah. Mm-hmm. Deb said on a public newscast that I was on with her that at no point did Kennedy or his staff get briefed by the vaccine experts at CDC. There was no interest in hearing what these people who are the world's experts in this have to say because they believe it's all wrong or whatever. But that was pretty surprising.
That's amazing.
And,
yes.
and Monterez too, when she was testifying recently, said that one more thing she was asked to do. Kennedy asked Monterez, the head of the CDC at the time, he said, I want you to meet with Aaron Siri, which is, again, the most prominent anti-vaccine lawyer we have here. And really, I call him, Kennedy's the name behind the anti-vaccine movement. This guy is the brains. The way he has demolished vaccine policy in this country through lawsuits is been really something to watch.
It's not just lawsuits. It's also hundreds and hundreds of laws at the state level to roll back vaccine protections.
We had a couple states have done that, like Georgia and Florida or something, or am I just
there's various things happening, but below the radar. That's Florida. The Surgeon General has said some very unscientific, unproven things about COVID vaccine and vaccines more generally. But dozens and dozens of states have had literally hundreds of laws introduced. And, these can slip through in a quiet legislative session easily that would basically chip away at vaccine policy and vaccine protections.
And then the other thing is that, Aaron Siri and just these groups in general are behind the lawsuits and the state actions that have tried to loosen vaccine exemptions for school children within states. So like Mississippi, I love this story and hate this story. Mississippi is about last in almost every measurable health outcome, except when it came to vaccines. When it came to vaccines, they were always #1. They had the most percentage of children who got vaccinated because so many of their kids went to public schools and because they had no exemptions. Like, you could not be exempt for anything but a medical reason, and which is very, very rare. What happened? Well, a group of parents that had been unsuccessful lobbying their legislatures to make this change brought in Aaron Siri, and Aaron Siri went and he introduced this law, sued the state, basically saying that we should have exemptions, sued the state, and he won because the Republican Attorney General refused to fight the lawsuit. And so that just passed. And so now Mississippi children are less protected.
Unbelievable. So basically we're stuck with this for 3+ years, right?
We'll see. You're a better judge of that than I am.
No, I'm not.
I do think ultimately people do want to be healthy, and facts are stubborn things. And this constant spreading of incorrect, unscientific, false statements ultimately will catch up.
I often think about what's going to be the thing that gets Kennedy tossed out.
Mm-hmm.
And we thought it might be measles at first, right? Because we heard that Trump did not like kids dying of measles, that was not a popular thing within the White House. People were like, quit it with the kids dying of measles. Mm-hmm. And so that wasn't a popular thing, but that has, we haven't had any more dead children in a while. And so maybe that he got off free for that, but what is going to do it? And that press conference to me seem to suggest that there's not much that Kennedy could say or do to lose Trump's backing at this moment.
So, yeah, he's with us for the long haul here.
At least until the midterms.
Well, he won't be blamed for any midterms, and we don't know if there'll be, what those midterms will be like. So,
who knows? Week is a long time in politics, but a day is a long time in health.
So let's talk about your book for a second. The Formula for Better Health: How to Save Millions of Lives, including your own. This is about saving lives.
It is. I started writing this 10 years ago at the height of the Ebola epidemic in West Africa, when it became really clear to me that people don't know what public health is, don't understand why it's important.
Now, Ebola, of course, was your biggest crisis.
It was. It was the world's first epidemic. And it almost got really out of control. And it caused a lot of political consternation in the U.S. It happened to be at its peak during the midterms here. So it was a tough time. But ultimately, really heroic CDC staff, hundreds and hundreds of staff, spent thousands of hours, went to every community in all 3 countries where Ebola was spreading, helped trace every contact, work with every organization, support healthcare, support the tracking, and really with the frontline work, not primarily of CDC staff, but of the frontline workers in West Africa, the epidemic was stopped. But it got really out of control, and it shut whole health systems, and it caused huge problems. And it shows that we really are all connected. There were cases in this country that was spread in one hospital in Texas.
That was somebody, they treated him wrong. Yeah.
The patient came in, they missed the diagnosis. He came back deathly ill and highly infectious. They didn't have the right kind of gowns and gloves for the nurses, and 2 of the nurses became infected. Both of them survived, fortunately. Sadly, the patient himself died. But it made it clear we are vulnerable to these things.
But I think the CDC did an amazing job. So there.
You never get it all right? You never get everything right. But CDC did surge to every community where this was spreading in West Africa, to every hospital that had cases in the U.S., and improve the detection, management.
Would it have made any difference if you had been the head of CDC, or if the Democratic administration been head of CDC, in terms of our response to COVID, in terms of our presence in China, in terms of, would that have made a difference? Self-serving for you to say. So
I can't speculate, but I can say some of the things that would have been different, I'm sure. One is the Trump administration had pulled back on CDC presence in China. When I was CDC director, we had a big unit there. It was a collaboration. And at one point, there was a new strain of flu that emerged. And the CDC disease detectives and the Chinese disease detectives were working side by side on that, and they stopped it. Now, would that have happened with COVID? No way to know. Pretty hard to have controlled it in retrospect, but you don't know. The second thing that was really problematic, and I talk about this in the book, there's a formula for better health that has been proven to save millions of lives, can save millions more, including your own. And it has to do with seeing that you can see the threats that are coming, believing you can change them, and creating a healthier future. And part of that creating a healthier future is organizing well in an emergency. And what was so striking in all of 2020 was that there was no organization at the White House. You had the White House, HHS, FEMA, a COVID coordinator, you had President's son-in-law, all doing different things. And it was very chaotic, and it showed. And the irony is that my organization, Resolve to Save Lives, we were working in more than 15 countries in Africa to help them set up these, what's called an incident management system, and they were working really well. So it was really hard to see this not happening in the US while it was happening, and we were helping it happen elsewhere.
Remember, he said that the problem was when I got here, the shelves were empty. And the thing is he'd been there for, like, before it hit, he had been there for 3 years. He could have filled the shelves.
I mean, the other thing that was really problematic in the first Trump administration, and that, frankly, I think the Biden administration didn't get entirely right either, was communication. CDC wrote the playbook on how to communicate in an emergency. Be first, be right, be credible, be empathetic, give people practical, proven things to do. The Trump administration basically violated every single one of those. And they also politicized the vaccines by saying this will be our accomplishment. Now, they deserve a lot of credit for Operation Warp Speed. They may not want to talk about it for whatever reason, but it shows that government can work well with the private sector.
He deserves a Nobel Prize for it, among other things. So you should get the medicine and peace. I'm sorry I interrupted you about the book.
Well, I think basically there is an approach, and it has to do with seeing the health threats clearly, seeing why we don't see them and overcoming those things, seeing the path to progress, seeing whether our programs are succeeding or failing. It's seeing the invisible. And it's frankly a superpower of public health. In Ebola, it was a model that showed the Obama administration and the world that unless we took urgent action, it was going to explode all over West Africa. And that one model allowed us to see the future and prevent it. The next thing, though, is to believe you can do something about it, because all too often people assume that the present represents the inevitable future. And in fact, you can change a lot. And doing that, you can show that we've had a lot of successes in the past. RFK Jr. said he couldn't think of a single success. I can give you 20 or 30. Healthier kids, healthier births, healthier young adults, less cancer, less heart disease, less stroke. Fewer people dying on roads and from traumatic brain injury, $2 trillion saved from vaccines, fewer women dying, just a few.
Well, you start the book talking about lead in gasoline. I mean,
it's a huge, huge success story, a delayed one because we didn't listen to the warnings of a remarkable physician 50 years earlier. And then working together to create a healthier future by organizing, simplifying, communicating, and overcoming the political barriers to making progress. Because often it's the insurance companies or the parts of the healthcare system or the manufacturers of tobacco and junk food that are really undermining our ability to make progress. But there is a way to overcome that. And that's what the book is about. And when you take the kind of epidemiologic disease detective way of thinking, you can also cut through a lot of the hype, sloppy thinking, and profiteering about personal health to say, hey, what are the things that are actually going to work to help you live a longer, healthier life?
Less salt, more squash, I guess.
Well, that's one of them, two of them.
Yeah.
The keys to healthy living are actually pretty straightforward. There's 6 things that virtually everyone can do, and they're within reach, and they don't cost very much or nothing. The first is to control your blood pressure. Blood pressure actually kills about 600,000 Americans a year, causes a lot of heart attacks and strokes, and ideally you want it under 120. Control your lipids, get good physical activity, at least 4 days a week, at least 30 minutes each time, get 7 to 9 hours of sleep every night, avoid toxins like tobacco and alcohol, and eat healthier. And there's some more tricky things about what eat healthier means: less salt, more potassium, less sugar, more fiber, less processed meat, more healthy food you like, rather than trying to deny yourself some foods that you don't like, that you like that aren't healthy.
Well, there it is. Those are the 6.
Those are the 6.
Thank you both. Brandy, you want to add to that, the 6?
Oh, no, I wouldn't even begin to suggest that I know how to be a healthy person. I'm hanging on by a thread.
Well, thank you both. It doesn't feel like we're going to be, we got bad news about our progress on vaccines and stuff, though.
Facts are stubborn things, and people want to be healthy. There's still a lot of great work going on by doctors and nurses and the people who have stayed at CDC, toughing it out to protect Americans, because that's what CDC does, work 24/7 to protect Americans from threats.
I have a much less rosy outlook on the whole thing. I think when COVID started, I remember, because I've been covering Kennedy for over a decade. And somebody asked me, I was right by the med unit, and they were, COVID was here, and they're like, what do you think is going to happen to the anti-vax movement? And I was like, are you kidding? It's over. It's done. Like, people are going to be lining up for a vaccine. Like, this is the thing that we've been warning about. Like, one day there will be a pandemic and you will be lining up for a vaccine. And not only did that not happen, but like the actual inverse happened and they gained like political power. And so, if you think that they're going to just let go of that power or have it taken away from them gently, like, I just don't see it. And unlike COVID, where, 1 million people died, if we want to pretend like that didn't happen, or they refuse to believe that happened, now this is children. We're talking about children are going to be the victims of this. And I just don't see it ending anytime soon. I think it's going to take something really terrible to happen for us to figure this out.
Well, that's how we like to end.
Sorry.
On that note.
Look, there's a lot of technological progress. We have better vaccines, better treatment, better prevention than ever in human history. People are healthier than ever in human history. And ultimately, people want to be even healthier, and it's possible.
There you go. There, we'll end there. Thank you, guys.
Thank you.
Thanks, y'all.
Well, I hope you enjoyed listening. That beautiful music is by Leo Kottke, the great Leo Kottke. I want to thank Peter Ogburn for producing this podcast. We'll talk again next week.